Hello everyone. In this video, we will be studying about the toxins, their specific odors and their specific antidotes and the diagnostic tests. So first we are studying the odors. In the first, it is acrid smell. Acrid smell is of the paraaldehyde and chloral hydrate. Then is bitter almonds. Bitter almonds, cyanide, burnt rope, marijuana or cannabis, carrot like water, hemlock, and garlic like past. Okay, the mnemonic is past. Phosphorus, arsenic, selenium, thallium, and telluride. Phosphorus, that is organophosphorus compounds, and arsenic and selenium, thallium, and telluride. These will have garlic odor. Then fish or raw liver or musty odor. It will be of phosphides. Remember fishy. Fishy by P. Okay, so phosphides, zinc phosphide and aluminium phosphide will have fishy or raw liver odor. Then kerosene odor. Kerosene odor is of OPCs. OPCs have kerosene odor. Then rotten egg. Rotten egg is due to sulfides. Hydrogen sulfide, carbon disulfide, mercaptans, disulfiram, and N-acetylcysteine. Then shoe polish, nitrobenzene, vinegar, acetic acid, hydrofluoric acid. That is, vinegar is also acidic, so acetic acid and hydrofluoric acid will have vinegar odor. So let's revise again. Acrid is for paraldehyde and chloral hydrate, bitter almonds for cyanide, burnt rope for cannabis, marijuana, carrot for water hemlock, then garlic for phosphorus, arsenic, selenium, thallium, telluride, fish or raw liver for phosphides, zinc phosphide, aluminium phosphide, kerosene for OPCs, rotten egg for sulfides, hydrogen sulfide, carbon disulfide, mercaptans, disulfiram, and N-acetylcysteine. N-acetylcysteine is related to paracetamol, disulfiram is related to alcohol. Then shoe polish is with nitrobenzene, benzenes, okay, and vinegar is with the acetic acid and hydrofluoric acid. Then next we have the specific toxin and their treatment. Acetaminophen. Acetaminophen, also known as paracetamol, its treatment is N-acetylcysteine. Acetylcholinesterase inhibitors and organophosphates. That is for neostigmine, physostigmine. We will be using atropine more than pralidoxime. Then antimuscarinic or anticholinergic agents. Here we will be using physostigmine. Crosses the blood-brain barrier and controls the hyperthermia. Physo means freely. Physo will cross the blood-brain barrier freely, but neostigmine will not cross the blood-brain barrier. Then arsenic, dimercaprol, and succimer, benzodiazepines, fumagazine, beta blockers, atropine, glucagon, and saline. For the beta blockers, we will be using atropine, glucagon, and saline. Then carbon monoxide, poisoning, 100% oxygen and hyperbaric oxygen. Copper, for the copper, penicillamine and trientine. Penicillamine, remember three copper penny bodies. Penny means penicillamine and 3 trientine. Then cyanide, hydroxycobalamin, nitrites plus sodium thiosulfate. Dabigatran is idarucizumab, digoxin specific antibodies, digiband, direct factor 10A inhibitors for 10A, 10A, XA is coming, and dexanet alpha. Dabigatran is direct thrombin inhibitors, while direct factor 10 inhibitors are by the XA band. Then heparin, protamine sulfate, iron, deferoxamine, defracirox, and defripron. Lead, for the lead, EDTA, and dimercaprol, succimer, and penicillamine. So penicillamine, which was for copper, that is also used in lead. Then dimercaprol and succimer, that for the arsenic, that are also used in the lead poisoning, and EDTA. Then mercury, dimercaprol, and succimer. So dimercaprol and succimer is for the arsenic, for the lead, for the mercury. Then methanol or ethynyl alcohol, ethynyl glycol, in fomepizole, or ethanol, more than ethanol, and dialysis. Methemoglobin, methylene blue, and vitamin C. For methemoglobin we use methylene blue and vitamin C. Methotrexate, leucovorin, Opioids, naloxone. Salicylates, sodium bicarbonate. Here, sodium bicarbonate just alkalinizes urine and dialysis. While in TCAs, tricyclic antidepressant, sodium bicarbonate stabilizes the cell membrane. It will not help in the excretion of the poison. It will just stabilize the cardiac cell membrane. Then we have warfarin. For the warfarin, we have vitamin K and prothrombin complex concentration of fresh frozen plasma. Freshly frozen plasma means which have very much of the proteins or the factors of the coagulation that will be given for warfarin, and vitamin K for delayed effect. So let's revise again the poisons and the treatment given in this table: acetaminophen, paracetamol, N-acetylcysteine, acetylcholinesterase inhibitors or organophosphates, atropine, antimuscarinic or anticholinergic agents. Then physostigmine, arsenic, dimercaprol succimer, lead dimercaprol succimer, mercury dimercaprol succimer, and copper is penicillamine trientine. Then for the lead we have many. Okay, benzodiazepines, that is sedative drugs, flumazenil, beta blockers, atropine, glucagon, and saline, carbon monoxide, 100% oxygen and hyperbaric oxygen, cyanide, hydroxycobalamin nitrates, and cyanide we represent by CN. So for C we have cobalamin, and from N we have nitrites. Then dabigatran, direct thrombin inhibitor, idarosizumab, digoxin, digiband, direct factor 10 inhibitors, and dexanet alpha, heparin, protamine, iron, defrasirox, deferoxamine, and defripron, methanol, ethylene glycol, famipizole, methemoglobin, methylene blue, and vitamin C, methotrexate, leucovorin, opioids, naloxone, salicylate, sodium bicarbonate. Salicylates means aspirin. For that we use sodium bicarbonate. For TCS we use sodium bicarbonate. They have different functions. And warfarin, vitamin K, and fresh frozen plasma. Then next we have few other poisoning treatment. Drug induced dystonia. Dystonia we will use benztropine, diphenhydramine, and other drug is trihexyphenidyl. So benztropine, diphenhydramine, and trihexyphenidyl. These are used in drug induced dystonia. Then neuroleptic malignant syndrome, bromocriptine. Leptic malignant syndrome, bromocriptine. Leptic cryptic. Okay, remember by this. Then CCBs and fluoride. For the calcium channel blockers, we use calcium gluconate. And for the fluoride also we use calcium gluconate or chloride. Calcium chloride. Then valproate and hyperammonemia. Valproate causes liver toxicity, hyperammonemia. We use carnitine. For malignant hyperthermia, malignant hyperthermia is dantrolene. Okay, if it is malignant hyperthermia, then dantrolene. If it is neuroleptic malignant syndrome, neuro is coming, then bromocriptine. Neurobromo. Then sulfonylurea induced hypoglycemia, octreotide. Octreotide, okay. Then isoniazid seizures, pyridoxine, nicotine, trimethadione. Trimethadione. And another thing for nicotine is mecalamine. Mecamylamine. That is also known as inversin. So tri trimethadione and methadione and me mecamylamine. Different means names, difficult name, that is for nicotine. Then coumarin or indione, vitamin K1, phytonadione. That is, so let's remember again: drug induced dystonia, benztropine, diphenhydramine, that is related with the antihistaminergic drugs, and trihexyphenidyl. Neuroleptic malignant, bromocriptine. Malignant hyperthermia, dantrolene. CCBs, fluoride, that we use calcium gluconate and calcium chloride. Valproate, hyperammonemia, carnitine. CCBs, high dose insulin. In CCBs, high dose insulin can also be used. In sulfonylurea induced hypoglycemia, octreotide, isoniazid seizures, pyridoxine, nicotine, trimethadione, and mecamylamine. And coumarin, or that is warfarin type drugs, that we use vitamin K1, phytonadione. Then next we have the diagnostic test. Although they are not used nowadays very much, but we need to remember the names. So Trinder's test. Trinder's test is for salicylates like aspirin. Then ferric chloride test. Ferric chloride test is for phenol, phenothiazines and salicylates. Then we have Lee-Zones test. Lee-Zones test is for cyanide. Mixner and Miser's test. is coming, so it is for mushroom. Mixner and Miser's test. Isonitrile test. Isonitrile test is for CCl4 chloroform. Then litmus test for corrosives. Marquis test. UI is coming and UI is also coming in opium. Marquis test is for opium. Marsh test or range test. ARS is coming. The arsenic. Silver nitrate test. AG, silver, AG, and aluminium is AL. So similar. So silver nitrate test is for aluminium phosphide. It was having fishy odor. Then Cavard test for alcohol and Tensilon test. SIL. SIL उल्टा कर दो botulism में आ रहा है. So tensilon test. What we can remember easily from the mnemonics, tensilon is for botulinum. Then silver nitride for aluminium phosphide, Marsh test, range test for arsenic, Marquis test for opium, Mixner Miser for mushroom. Then which are litmus test for corrosives? That is also simple. Then which are left? Isonitrile, that is for CCl4. Similar means atoms are linked with the carbon, chlorides are linked. So CCl4 and chloroform. Then Lee zones test. Lee zones is for cyanide, ferric chloride, and Trinder's test. That is for salicylates and phenol and phenothiazines. So that are about the diagnostic test. So that were all the important points about the poisonings and the antidotes, diagnostic tests, characteristic odors. I hope you will find the video useful, and if you like my content, please do subscribe my channel. Thank you.